VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We're servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And today we are excited to interview Dr. Jason Weisstein, who is an orthopedic surgeon. He's right here at the Cleveland Clinic in Port St. Lucie, and you can make an appointment directly with him at 772-212-0732. How are you today, doctor?
I'm great. Thank you very much.
Oh, wonderful. Thank you for joining us today on the show. We appreciate you taking time out of your busy schedule and coming to see us and educate us. We have a group of, an audience listening that really wants more information on obviously what you do. And I usually like to if you can tell us a little bit about your background and a little bit about, where you went to school, why you decided to specialize in orthopedic surgery and a little bit about that. And then we can move on to some questions.
Sure. So I'm originally from California, but trained in orthopedic surgery at the University of California, San Francisco, where I did my residency. And then shortly after that, I completed a fellowship in adult reconstruction and limb salvage with the focus on joint replacement, treatment of tumors, infections, and limb deformities at the University of Washington in Seattle. I've been in practice for about 20 years and have been with Cleveland Clinic for about almost 3 years. Nice. I really embraced orthopedics because I am really a personality that likes to see results fairly rapidly. And I think most of us in orthopedic surgery are happy to say that what we do fixes things and gets people back to a good quality of life without, a protracted period of follow-up for years.
I like that. You help so many people with so many different ailments and different things. I also read that you you were also with orthopedic oncology. Is that right? Did you mention that?
Yeah. So so when I mentioned I trained in limb salvage, I basically tell people that I trained in the art of caring for limbs that are threatened by things like tumors, infections, but most commonly arthritis. But I do, as a side passion, I see patients with lumps, bumps, and strange-looking bones, many of which are tumors, and that kind of encompasses the field of orthopedic oncology.
Oh, got it. Interesting. And I know you've also done a lot of peer articles related to joint replacement. So not only are you helping us hands-on, but you're also doing some articles. Is that right?
Yes. So, I've published, but I also serve on some editorial board for one of the preeminent hip and knee replacement journals in orthopedics. So I'm seeing the peer-reviewed journals, the evidence-based medicine, so that I can really speak to, what I recommend for patients, not just based on anecdotal experience, which is nice, but it really isn't science. I can speak really based on science because I'm constantly seeing articles that are published by researchers and medical institutions across the United States and the world.
Well, thank you for staying relevant. We appreciate doctors that are always, continuing to stay relevant because I believe so many things change so rapidly.
Absolutely.
Yeah. And also, you have an expertise in robotic surgery. Is that right?
Yeah, so about 2010, I was working in California, and there was a real interest from the people that governed the hospital in robotics. There was also a real interest in orthopedics as we learned from general surgery, from um, general surgery robotics, that robots possibly could do things more precisely and more accurately. So around 2010, the hospital I was working for bought a couple robots. At that time, it was very new in orthopedics. And we started doing what was called partial knee replacement, where we don't do full knee replacements, but we use a robot to help us do just a part of a knee replacement. And it became wildly successful, very reproducible. And I think, I kind of call it like the Star Wars mentality. It really brought on a following of patients because I think people think of Star Wars and,
Yeah.
C3PO and R2D2, and that must do it better. But in reality, it's not C3PO or R2D2. It's still the surgeon doing the surgery.
Yes.
It's the robot that is enabling the surgeon to do the surgery better and more precisely with the accuracy of a robot.
I like that. So you're working in conjunction. We always want the human aspect in it, and it obviously helps to know that there's a robot involved. But I feel that as a patient, we like to know that we have an experienced surgeon who's actually driving the whole surgery. So
Yeah, the robot doesn't do anything autonomously. I don't think that would ever be FDA approved, obviously.
right.
So, the robot, I used to train residents and fellows, and, I think the way I think about it is you still have a surgeon. It's just that the robot is adding extra information so the surgeon can do the surgery better.
I like that. And I'm sure the patients are happy. What is the turnaround time for this type of knee replacement?
So, in terms of the surgery itself, I mean, it's still done about the same time as traditional knee replacement or hip replacement. So, somewhere between, 50 to 90 minutes is about average.
Wow.
And I would say a good percentage, probably 30% of our patients are going home the same day.
Wow.
The robot, I would suggest, is a little bit less invasive. So I think that patients recover faster. Some data that's been published supports that. And, recovery from a knee replacement is different than a recovery from a hip replacement. Hip replacement patients take a couple months. Knee replacement patients probably take on the order of 3 months to fully recover.
I see.
And so, in general, I think this is not a quick turnaround operation. The operation is the easy part. It's the
Right.
recovery, getting back to normal, that takes a long time.
Let me ask you a question. I'm curious to know, why is it that certain people need a hip replacement or a knee replacement? Is it that some people are genetically, is this passed on from our ancestors, from our parents, or are there other factors involved?
Yeah, so I mean, I tell patients it's kind of the rule of thirds. 1/3 of it is probably genetic. 1/3 of it is probably lifestyle. So maybe you had some trauma in your lifestyle, a car accident that injured your hip or your knee. You had a skiing accident. You had an ACL
Right.
tear and it was reconstructed. Maybe you're obese and that puts a lot of extra weight and is correlated with arthritis. So 1/3 lifestyle, 1/3 genetics, and 1/3 we clearly just don't understand, because if genetics was so important, most people would probably have it on both sides. Why do the majority of patients only have arthritis on one side and not both sides equally? And so,
Interesting.
it's kind of the rule of thirds, but certainly lifestyle plays a role. That's the only thing that, I counsel patients that they can manipulate. The rest, 2/3, I think, is really just, genetics, and we're still discovering.
So, when you say lifestyle, is this as we age, these weekend warriors, how, we're running around and trying to do, tennis and pickleball and all these,
Yeah, I mean, I
half
think
marathons?
Yeah, I mean, I think the tennis, the pickleballs, the half marathons, that doesn't lead to joint replacement. I think what does lead to joint replacement is certainly aging as a risk factor. So
Mm,
obviously, people who are older, it's the analogy I use is a tire. So the tire tread wears out over time. Some people drive the car faster and harder, and that tire wears out more quickly. Some people drive a little bit more gently and cautiously, or maybe don't drive at all, and that tire lasts a lot longer. So certainly, doing exercise doesn't wear out the tires. It keeps you healthy, keeps you active. There's lots of benefits, and like everything we do in life, what we do is really a risk benefit analysis. I mean, I would tell you that pickleball seems to be the new injury making
yes,
sport. You'd think that orthopedic surgeons devised the game to get more business.
I've heard.
But the senior population seems to just gravitate towards pickleball like no other sport these days. And I have seen plenty of injuries, not that lead to knee arthritis, but I see plenty of patients who are trying to keep in shape so they don't get overweight, so they keep their cardiovascular, their heart, their cholesterol down, and just trying
Hmm.
to adopt a healthy lifestyle. I think that's good. I wouldn't discourage people from doing it, but
Sure,
obviously with some grain of caution.
sure. And Dr. Weisstein, I always like to ask, in your opinion, what do you think the importance of diet and lifestyle has to do overall with our, arthritis and how our body ages?
Yeah, I mean, I think diet and lifestyle are very important. I think lifestyle, keeping yourself at a ideal body weight is a challenge. It takes work, but that should be part of a healthy lifestyle. And I think, again, being overweight or being obese is certainly a risk factor for developing arthritis. Our joints were not meant to handle all of that weight. And so the
Mm-hmm.
knees and the hips take the brunt of the force. Um, I think diet is a little bit less clear. Certainly, there are many patients who feel better when they eat, a clean diet. Things like what we say Mediterranean diets,
Right.
which are fish and seafood and vegetable based, as opposed to like red meats and alcohol, which are more inflammatory. And it's the inflammation that I think leads to painful joints. So
Mm.
certainly we don't understand it fully, but it seems like low inflammation diets like Mediterranean diets where there's more seafood than red meats and alcohols are probably beneficial for joints.
Yeah, I mean, we hear it all the time about these blue zones, right? These different countries
Mhm.
that have, different factors that involve diet and, I guess, lifestyle and community and connection. They seem to age at at a much more graceful way than
Well,
some.
right. I mean, it's like, I mean, I think a lot of this aging gracefully, I mean, certainly lifestyle seems to be such a big part of it. I mean, we think dementia, even though I don't want to get off topic, we think dementia may be just a series of micro mini strokes where, blood is not circulating the way it's supposed to in the brain. And,
Wow.
so, higher cholesterol, obesity, diabetes, poorly controlled diabetes, these are all risk factors, I think.
Sure.
But certainly there's parts of Italy where people are living well into the hundreds. I just saw a program on that. I think it was a Netflix program, but it's
Yeah.
fascinating. But they're all eating very healthy, clean diets.
Yeah.
But they're also very active too. They're doing
Yes.
something. They're engaged doing agriculture, working outside. You know, you can say what you want, but I mean, there are certainly real problems with American lifestyle, and that's a sedentary lifestyle where we, get
Yeah.
in our car, we sit down and sit
Yeah.
in front of a computer and never really, do any meaningful exercise. So I tell patients it's really a matter of committing to finding a time so that it's a dedicated part of your lifestyle 3 or 4 times a week. It just needs to be that important to you. And I think if you embrace that,
Yeah.
you'll be in better health and your joints will be in better health.
Sure. And we live in South Florida. I mean, we have, the most amazing winters, so it can't be too difficult for us to get out and, whatever it is, I guess walking or any type of
Right.
movement to get our blood flowing. But yeah, I agree. I think we can all create habits, right? What do they say? It takes 21 days or a month to create a new habit. So I'm glad you're encouraging your patients, you know, to be, moving and to be active.
Absolutely.
Yeah, yeah. So I was looking into, I believe you have this same day discharge when you do a knee replacement. Is that right?
Yeah, so I mean, we've really at Cleveland Clinic here in the Martin system and all across Florida, we've really tried to embrace the benefits of same day joint replacement surgery, whether that be for a hip, a partial knee, or a total knee. Now, that's not to say that every patient qualifies. We do a careful assessment of
Sure.
patients' medical history,
Mm-hmm.
obviously their social situation, whether or
Mm-hmm.
not they have somebody who's dedicated to helping them after surgery. These are all important factors for going home. But like I said before, we're around 30% plus, and several years ago we were basically 0% same day. It was a very foreign concept. It's not a cavalier thing. If you look back 20 years ago, patients were staying in the hospital 5 days
Yeah.
after replacements, and it's really been shown that hospitals are in some ways bad for you. There are medical errors, there are medication errors.
Mm-hmm.
You've got nurses who are poking and prodding you every couple of hours,
Sure.
and you know it's not always better to be in a hospital. There are sick patients. Your risk of infection might be higher if you're in the hospital too long.
Right.
I think the real satisfaction for patients is when they need like pain medicine after surgery, they don't have to wait on a nurse. They just go right to the bottle at their nightstand and they can take it immediately.
Yes.
They also can sleep through the night without having a blood pressure cuff attached to their arm every 4 or 6 hours.
Oh, yeah.
Um,
I
yeah,
think
so those
they,
are some of the little benefits.
yes, I agree. I think there's a lot of benefits. I remember back in the day, you said maybe 20 years ago, they were in the hospital for days on end. We have a quick commercial break. We'll be right back. We'll continue our conversation. Stay tuned, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Back in. Right here in Port St. Lucie. You can reach him at 772 212-0732. He is a specialist in joint replacement and revision surgery. Can remind me again, revision surgery, what type of candidate gets what does that mean, revision surgery?
Yeah, revision is just any patient who needs another surgery after they've already had a prior hip or knee replacement. So sometimes the parts wear out. Unfortunately, what we see all too often is infections in people who've had prior joint replacements, which can be real tragic events. So those patients are often redo surgery in somebody who's had a joint replacement. I've lost microphone here.
Of what type of materials are used in the knee replacement?
So in knee replacement, commonly we use polyethylene, which is a medical grade plastic. That is essentially the new cartilage. And then the prosthesis, the knee replacement itself, is made of a variety of different types of metal. Sometimes cobalt, sometimes chromium, sometimes titanium. We're having mic issues.
What is your specialty?
I'm sorry, the microphone cut out on my end. I couldn't hear you.
Sorry. I was just asking, what is your specialty? Is it knee replacement or hip replacement, or what do you?
It's both.
You do both.
I mean, I do both, and I do a lot of both. And the big thing I think with knee replacement is not many people do partial knee replacement, which is a really wonderful surgery for appropriately selected people. Not everybody has arthritis all over the knee. Many people, in fact, the majority of people have it only in one compartment. And those patients can often be really good candidates for partial knee replacement, where just a small segment of the knee is replaced. And almost all of those patients go home the same day. We do it with a robot. And these are my happiest patients because they get to brag to all their friends who've had painful knee replacements how quickly they recovered.
Right. Yeah, I would imagine that a person would prefer to have a partial knee replacement instead of having the whole thing if that's all they need. It's like you've customized it to what they need. So I believe that is definitely more appealing to a patient, I would imagine.
Yeah, it definitely is more appealing. The only thing I tell patients is that if they develop arthritis and other parts of their knee, they're not protected. But by the same token, why fix it if it's not broken, right?
Yes.
So it's not like cutting hair. If you cut the cartilage off, it doesn't grow back.
Yes.
It needs to be replaced.
Is there anything that you'd like to share maybe about, our older senior patients who are getting knee replacement surgery? Are they, maybe anything in particular you'd like to share that they would need to know?
Certainly. I mean, we see a extraordinarily large senior population here in Martin County and St. Lucie County. And I think the important thing to know is that, chronologic age is not necessarily a bad thing. I would tell you that most of my patients who are in their mid to late 80s, even early 90s, who have had joint replacement are in many ways biologically much healthier than many, many of my 50 and 60-year-old patients. So
wow,
age in and of itself, while it can be a little bit of a risk factor, it's the biology. It's whether or not you have heart disease, liver, kidney, lung, diabetes. That type of stuff is far more important than just your chronologic age. And so patients are often shocked. I had a patient who was 90 the other day who came in sharp as a tack, no medical problems, and underwent hip replacement just last week and did lovely. I mean, I think a lot of the seniors who are, of advanced age are probably going to outlive most of us.
Wow, that's impressive. Unbelievable. Dr. Weisstein, we actually have 1 minute left. This interview has gone by so quickly. So we're in this last minute, any last thoughts that you want to share with our audience before we let you go?
Sure. I mean, I think our robotic program here at Cleveland Clinic has really blossomed. We are the county that has multiple different types of robots. We have 3 different surgeons who are utilizing robots to do orthopedics.
Nice.
And I think robotics is really where orthopedic joint replacement is at, primarily because we are able to obtain such precision and accuracy that I think it truly benefits patients in the long run. I tell people I can't, with my eye, tell the difference between 2 and 4 degrees,
Right.
but the robot can
Wow.
every single time. And that really does matter when we're doing joint replacement. And I think that leads to better outcomes ultimately and happier patients.
Absolutely. Well, I will certainly be referring you, Dr. Weisstein. So anybody who's listening, please give them a call, 772-212-0732. Thank you again so much for your time and all your knowledge. We appreciate you sharing with our audience. Have a wonderful evening.
Thank you so much.
All right. Take care.
You too.
Bye.
Thank you. Bye-bye.